Good afternoon and welcome to our daily media briefing. We want to apologize for the delay. We've been pulling together the latest information and we've had a few computer glitches, but we're ready to go now with today's briefing. We're joined today by Supervisor Fletcher, who's going to be going over some of the charts and updated information as he usually does. And then we're going to hear from Dr. Wooten, who's going to talk on the medical front, what's been going on there. And then we also have a number of our county team available if there's questions that come up in the Q&A portion. Yesterday was a critical day in our nation's fight against COVID-19. And there are two numbers that brought home the reality of what we are facing. The confirmed number of COVID-19 cases topped 1 million in the United States. Think about that for a moment. 1 million cases. Meanwhile, the number of deaths went over 58,300, which is more than the number of Americans killed in the U.S. and Vietnamese War. Think about that number also for a moment. That's over 58,000 deaths in a period of the U.S. involvement in Vietnam that historians cite as totaling a total of 18 years. We've hit 58,000 COVID-19 deaths in just 2 months. I cite these numbers not to scare people, but to put into context our discussions about the future and the possibility of reopening our society. I certainly empathize with everyone who wants to go back to work and with the small business owners who have suffered so much, who are afraid that their shops and restaurants and companies will close for good. In the past few weeks, we've heard from you and we're listening to you and talking about trying to do things that are going to ease your pain, and we're certainly taking your comments and suggestions into consideration. But I want to emphasize that while we can take limited measures on our own, the decision is ultimately up to the governor of California. Counties do not have the ability to get ahead of the governor's executive order. Counties have the ability to be more restrictive than the governor in their public health orders, but not less restrictive. We must be guided by the framework for reopening put out by Governor Newsom yesterday and by the medical data and the facts on the ground. Rushing ahead of the state would create legal issues and would lead to different rules up and down the state that would just confuse people. And let's be real, people are not going to feel comfortable going back to non-essential businesses until we get a better handle on public health. My colleague, Supervisor Diane Jacob, last week during our Board of Supervisors meeting, I think summed it up probably most eloquently. She said, until we solve the health care crisis, we're not going to solve the economic crisis. But I want to emphasize that we are taking and talking about reopening businesses, and we are certainly planning for it. The Recovery Economic Advisory Group that has been constituted by Mayor Faulconer and myself just had its third meeting yesterday, and we are getting good input and ideas from its members about how they will reopen when the time comes. We have received business plans from you, including, I want to thank Supervisor Desmond, collected over 400 plans and input from businesses up in North County. I really appreciate the information that they provided. We're going to copy this and make it available as we begin to put plans together in San Diego County to reopen businesses. And I appreciate their pledges to reopen safely. And they've all included that in this document, and I appreciate it. I want to thank all of you for coming up with these plans and ideas about how you will open your business in a safe and responsible manner. And I want to say thank you to the many who have sent tweets, Facebook messages, and who have called. I have to tell you, I'm probably not going to be able to respond to all of those communications, but we are taking a look at them and we will consider them as we begin the plan to reopen businesses. I intend to certainly make copies of these documents available for our staff here in San Diego County, but I'm also going to be forwarding this on to the Governor of California for him to consider as he begins to look at the date that they will be focusing on reopening non-essential businesses. And I'm encouraged by what I'm seeing and what I'm hearing. So to make things a bit easier for those businesses that are working on their business reopening plans, I'll be bringing a proposal forward at our next board meeting, along with my COVID partner here, Supervisor Nathan Fletcher, that provides a set of standards, safety standards, we can ask businesses to adhere to when the time comes to reopen. The road back is going to be long and difficult, and the only way to get there is if we all work together and be smart about it. So thank you, San Diego, for working with us this past month of April. We're almost at the end. I think you're going to be hearing, I think, some good news in regards to the relaxing of some standards in regards to recreational opportunities. And I think we'll be in a position to lay those out more clearly tomorrow. With that, it's my pleasure to welcome Supervisor Fletcher.
Thank you, Supervisor Cox. Good afternoon. As Chairman Cox mentioned, he and I will be co-docketing a letter for our board to consider on Tuesday. Again, this is outlining the safety guidelines for businesses that we want them to be prepared to meet when we hit those stages and the governor either makes a statewide determination that we are moving into his stage 2 or allows counties, if they are ready. These will really focus in on a lot of what businesses should be looking to do when we open up. Some of this is derived from the existing guidelines around the 7 sectors of essential businesses that are open today. There will be a couple additional things that will be in there. But again, the aim and the goal is to put in place a series of protocols that will apply consistently across all businesses when they open. These are things we've been talking about. I think you can go back to last Monday when we talked about them more in depth. Things around face coverings, which are going to be countywide effective tomorrow. On-site temperature and health screenings, telecommuting when possible, hand washing and hygiene, designating individual staff people as your safety and health liaison, and a series of other things. And then we'll continue to work with the business community around getting additional input and guidance. We know that there's a lot of work that is being done, and we will continue to work to get their input and seek everything possible so that we can have as consistent and as clear as possible framework around what all essential businesses should be doing and what all non-essential businesses should be planning to do at the time that they are moved into the essential category and allowed to reopen. We are also continuing our work and effort. We've talked again, going back to last week, around efforts around parks. Individual jurisdictions have the ability to have their parks open, but there are countywide restrictions. The countywide restrictions are around the types of activities that can happen in parks, around parking lots, around other types of things. As we contemplate, again, we've had a goal of May 1st in working with local jurisdictions where we would like to lift in part some of those countywide restrictions. We continue to work with them. We've put up guidelines, have been online since Friday. We've had multiple stakeholder meetings with local governments. We continue to seek their input and guidance and look forward to making some announcements tomorrow around the issue of parks. And some potential easing, again, in partnership with our local jurisdictions for them to move forward when they are ready. Our T3 efforts around testing, tracing, and treatment, we know are a cornerstone of all of the efforts, not only of what we need to be doing daily and are doing daily, but what we need to be significantly increasing in order to be in a position to meet the daily need as we begin the easing, but again, to meet the daily need as we continue to advance through the COVID crisis, understanding that until such time as there's a vaccine or a widely available therapeutic drug, we will be in a status of daily testing, tracing, and treatment, along with monitoring our most important health indicators. Our T3 group continues to work. Nick Mascione, our Health and Human Services Agency Director, is leading that effort, and we plan on Friday to do a walkthrough of what are the testing goals, how are they derived from, what are the tracing protocols going to look like, how will we be implementing them, how many people do we believe we need as a part of that program, along with the various components that go into the treatment. And so look for an update on that process on Friday, but the work continues and remains in an ongoing and very real effort. Quick update on homeless. Out of the total of all positive cases in San Diego County, we now stand at 28 individuals who have tested positive that have been reported or shared with us who are unsheltered. We still have had no deaths as a part of that. Yesterday, there were 202 tests conducted at the convention center for the unsheltered. We still do not have results for the ones from the day before or from those 202. And so we now stand at 969 total tests being done at the convention center, 2 positives, 644, 17 were indeterminate, will need to be retested, and 306 pending the results. The new entity they're doing the test, their reporting or their results are coming in a little bit delayed. And so as we get those results, we will share them with you. They're using a little bit different system. The breakdown to date is 704 residents there have been tested, 265 individuals have been tested. Before I jump into our chart, I want to give you a quick update. We're not doing the daily chart on PPE, but I would like to share that in the last 24 hours, we've distributed more than 300,000 face shields. That is in addition to every other individual item of personal protective equipment going up. Us as a county is our daily hospital utilization based both on COVID-related patients, but also what is the total capacity of our healthcare system and what is the total usage of our healthcare system. And that delta between the two is something that we look at very closely to ensure that we always have the surge capacity and the ability to meet the need. Because the governor and the state are particularly focused on daily hospitalizations, but in particular breaking out the subset of ICU bed utilization, we're going to start sharing with you every day those broken up graphically so you can see them. ICU beds are a subset of total hospitalizations. So when we've been sharing with you in recent days the number of COVID-related hospitalizations, the ICU COVID ICU usage is a part of that, but we're going to break it out so that you can graphically see it. But know that the questions around the healthcare system capacity and utilization, along with the percentage of positive on a day-to-day basis, are two things that we use to help guide a lot of our decision-making and a lot of our thought process. There's a number of other metrics that are taken into account, but those are two that we spend a lot of time looking at, and two things that guide a lot of the thinking around the actions that we take. And so with that, we will jump into our first chart here, which you will see. Again, today we were reporting 118 positive cases. This is out of 1,966 total tests that were done, which puts us at a 6% positive rate in terms of positive cases out of total testing done. You can see that that 6% is below where we are on a rolling average. Really, the most important thing to look at this chart is that purple line. And it's going to be uneven, it's going to be unsteady because the day-to-day totals will change, but we are looking for the broad trends and the broad trajectory in terms of the direction we're headed. We would like to see this slope downward, and we would like to see that continue to certainly not go up, at least hold steady, but preferably go down. And so the most important stat on here is that purple line, but of course the total number of reported tests is important too as we strive to get a little more consistency in that and to see a steady uptick in the number of daily tests that are doing. The second one that you'll see here is the one I alluded to earlier, and this is the breakdown of ICU, COVID-related in our ICU beds, and then COVID-related hospitalizations. And so you can see that right now we're reporting 381 total COVID-related hospitalizations. That includes 130 COVID-related in an ICU bed. As you can look at the duration of that, you can see relatively flat lines across ICU utilizations, little up, little down, but reasonably stable, certainly for the past few weeks. And then you can see the total number of hospitalizations. Again, we had a peak at the beginning of April. We have come down and remained reasonably flat. Again, you're going to have day-to-day fluctuations, but what we're looking at here is the broader trend lines. These include both positive COVID and suspected COVID because they are both COVID-related hospitalizations, and we adjust those as we move forward. The next chart simply has those totals overlaid along with the total beds in use. And this is important to keep in mind because when we talk about preserving the integrity of our healthcare system, we have to look at the totality of what we face, not just as it relates to COVID. And so on the bottom line there, you can see the total COVID-related hospitalizations by day in the orange lines, and then the blue lines are non-COVID folks who are in our regional healthcare system. And so what we're really looking at is the top delta there between what is our current bed capacity and what are we currently utilizing. We've added a dotted green line here just for consideration today of what it would look like if we were to reserve 1,000 beds that we wanted to make sure were available every day for COVID-related patients. We look at a number of metrics as it relates to the healthcare system, whether it be a percentage of total bed capacity or whether it be a set number that are being held for COVID-related patients. And in the coming days, we will further refine this and come up with a metric that when we hit that point, we would trigger our surge capacity. Surge capacity would be standing up our Federal Medical Center. Surge capacity would be activating our alternative care center at UCSD. Surge capacity would be possibly things we would do in partnership with our hospitals to create more capacity. And we also continue to monitor the orange line there. If we saw a significant spike or slope in those, that would be something that would be concerning, and we would look at potentially taking action around being concerned about the spread of COVID. The last one here is just the regular one you see. The doubling rate of positives is less important to us as we see an increase in testing. We will see an increase in positives, and so the doubling rate of positives is less significant now than it was many weeks ago, and so we expect that number to be less relevant to what we're going. We tend to focus on percentage of positives. The doubling rate of hospitalizations and the doubling rate of ICUs is something we continue to monitor on a regular basis because it does have an impact on our healthcare system, and that is one of our core drivers. You also see on here the estimated recovery that we report out every single day, 1,892. Again, this is an estimated recovery based on a statistical sampling 14 days after a positive test adjusted for any loss of life. That concludes my report, and now I will turn it over to Dr. Wilma Wooten for her Public Health Officer's report.
Thank you, and good afternoon, everyone, and thank you, Supervisor Fletcher. So, can I get the first slide, please? So, as a reminder, everyone heard the governor's briefing yesterday, and has already been stated. Our opening back up depends upon that tone and direction being given by our governor. But in the meantime, we are planning, and I'm happy to share information with you today that shows we are moving in the right direction. As a reminder, we are utilizing the 5 metrics from the gating, the federal gating criteria, and then we are aligning that information with the California's roadmap. So these are the 5 metrics as a summary, and jot them down if you need to remember them, but I'm going to go through each of these briefly. The first, next slide, is a downward trajectory of influenza-like illnesses within the past 14 days. And the last time I shared this information with you, we met this metric. The second metric is a downward trajectory of COVID-like syndromic cases within the past 14 days. The last time I shared this information, this was in progress. With the next slide, I'm happy to share and show you that both of these metrics are trending in the right downward projection, and this information is as of April 25th. So we can, if we continue to trend in the right direction, we can check these 2 metrics off. The third metric is related to positive tests. Next slide. So you can choose either or, and we've chosen a downward trajectory of positive tests as a % of total tests within the past 14 days. So the next slide shows the graphic that Supervisor Fletcher shared with you earlier, so I won't go into detail. But again, the data from yesterday showed that of the tests that were performed, 6% were positive. So again, there is some up and down, but the primary thing that we want to see in the past 14 days is a downward trajectory. So we feel this is also going in the right direction, and as we increase testing, that will also increase our just being better able to manage COVID-19 in our community and knowing what the status of positive cases are. And then the fourth metric is related to the ability for a region to treat all patients without a crisis care model, and has been described by Supervisor Fletcher with the hospitalizations. If we can show the next slide. That was previously met, and we still feel that we are meeting this particular metric. And the fifth metric is related to testing. So I will provide some additional information about testing. Next slide. Testing is also one of the 6 components of the governor's roadmap. And it is specifically the ability to monitor and protect our communities through testing, contact tracing, isolation, and supporting those who are positive or exposed. And this is the T3 that our agency director, Nick Mascione, talked to you about yesterday and has been referenced here today. If we go to the next slide, what I'd like to share, again, this is the information related to the testing. Our focus, again, testing, contact tracing, and isolation capacity. And there's a lot of work going on with testing with our laboratory task force, as well as with gearing up to manage the positive cases that will be revealed as a result of our increased testing, and then isolating those individuals that are and need to be isolated as a result of their positive test, and individuals that are exposed to them or have contact with them. And then in this last slide, what I'd just like to briefly go over is the process for testing. Now again, if people have symptoms, we are asking these questions. Do you have the following symptoms? Cough, shortness of breath, and then the third major symptom is fever, but the other symptoms in here can also be included. So then the question is, do you have these symptoms? If the answer is no, the next question asked should be, do you belong in one of the following groups? And you can see the various groups. There are many groups here that I think basically much of San Diego would belong to. If the answer is yes, then you would contact your healthcare provider to get tested. We're working with each of the healthcare systems to ramp up their testing capabilities. But if you don't have insurance or a healthcare provider, we do not want that to be a barrier. So if you are unable to get tested through your healthcare provider, then call 211 and ask for our drive-through testing nurse triage scheduler so that you can get scheduled. If the answer is no for these various groups, then at this time you are not considered, again, to be recommended for testing. But again, all of those various groups is a large number of individuals throughout San Diego County, so this provides the capacity to do extensive testing throughout our region. Next slide. So now I would like to share information about our global, national, and state statistics. And these statistics are based on data from the Johns Hopkins dashboard that was obtained noon today. And then we will provide the latest update for San Diego's numbers. Globally, there have been almost 3.2 million positive cases, including 224,700 deaths. Nationwide, there have been over 1 million positive cases, including almost 60,000 deaths. And for the state of California, 46,507 positive cases, including 1,875 deaths. Today, for the County of San Diego, we are reporting 3,432 cases, which is 118 more cases than yesterday, as well as 120 deaths, which is 2 more than we reported yesterday. Of the total number of cases, the age range has not changed, 3 months to 100 years. The age group from 20 to 49 is still at 51%, also giving evidence that COVID-19 is affecting all age groups and not just our elderly. And actually, due to the fact that we've implemented our stay-at-home measures for older individuals and people with underlying medical conditions, we feel that those actions have resulted in a lower number of individuals contracting the illness as well as dying from the illness. In terms of demographics related to gender, again, it's about the split. 49% are female, 51% are male, and 5 individuals had no gender information provided. 761, or 22% of the total number of cases, have been hospitalized. 241, or 7% of the total number of cases, have been admitted to the ICU. And again, the ICU number is a subset of those hospitalized. And the ICU number represents 32% of that total number of cases hospitalized. Lastly, for the 120 deaths, this represents about 4% of the total number of cases. And of the 2 additional deaths that we are reporting today, one is a female in her mid-80s and one is a male in his late 70s. And these 2 additional individuals did have underlying medical conditions. Also, of the 120 39 or 34% are Latino or Hispanic. 9 or 8% are Asian, 4 or 3% are Black or African American, and then 1 each for American Indians, Pacific Islanders, and multiple races, which each is 1% of the total. 4, again, of the 120 deaths had unknown race and ethnicity. And once again, as always, we want to share our sympathies and condolences to the family members and friends of the individuals that we announced today who have lost their lives. Regarding outbreaks in congregate and community settings, today we are reporting a cumulative number, or a total of 43 confirmed active outbreaks and 1 new outbreak since yesterday, for a total of 29 in congregate facilities, representing 700 cases and 63 deaths, and 14 in community setting locations, and there have been no increase in the number of outbreaks in this category, and this group represents 129 cases and 4 deaths. Again, I would like to recommend the public for staying the course. The results that we see here today, San Diego, is because of your diligence, your commitment, and your staying the course to staying at home and following our health officer's orders. So with that, I would like to welcome back to the podium Supervisor Cox. Thank you so much.
Okay, we're going to go directly to the questions. Again, as we ask you to come on, please, if we have not identified you by your outlet and your name, please do so when you're introduced.
Matt Hoffman with KPBS. Please state your question.
Hi, Palomar Health, we know that they just recently laid off a few hundred employees, and we know that healthcare systems countywide are being impacted by the virus. In your routine calls with these hospital systems with patient volume sharply down, is there a worry that more layoffs could be coming? And is there a concern that as medical staff are let go, some positions are eliminated altogether, that we don't have the capacity to be ready for a possible surge in cases? I know you talked about the 3 S's, and one of those is staff.
Okay. Dr. Wooten?
So you've laid out some definite concerns, and there is one hospital that's been in the news where we are aware that they have laid off staff. And that definitely is concerning. That's one example in one situation, but across the board, I think that that is not the situation. We are very concerned about that, however, and we continue to work with our healthcare system and identify the areas, because as we open up, that will be an opportunity for staff to be brought back, but again, we have to marry that with moving too fast and then allowing clients, or patients rather, to be seen and the exposures. But I can tell you, COVID-19 really has changed the way we do medicine, and now we have telemedicine that has taken a front stage for how physicians interact with their patients. But again, laying off of staff is a concern to us, and I don't have an answer for how that will be improved, except that as we open up, staff hopefully can come back. Thank you.
Gotcha. And just to follow up on some of that, in terms of what else you're hearing from hospitals, I know you guys have said that countywide we're seeing a big drop in people actually going to the hospital to seek help. Do you think that we sort of overcompensated too much by telling people not to go to the hospital early on during the outbreak, and now these layoffs are sort of like an unintended consequence?
Well, actually, what happened is exactly what we wanted to happen, and that is that we were trying to stave the curve down, or smash the curve, if you will. That actually is happened, but on the flip side of that, if you don't have as many patients as you once had, there is potential the issue of having to lay off staff, or those staff not being utilized. So it's a bad and a good thing in some ways. Bad in terms of laying off staff, but good in terms of the fact that we did not overwhelm or impact, negatively impact our healthcare system. And I see Dr. McDonald wants to provide comment.
Sure, I do have a couple of comments on that, because this, it really touches on two things that I think are very important for the public. Number one, a lot of the folks that were in the hospital before COVID-19 were in the hospital for very good reasons, but the procedures they may have had may have been non-urgent, but yet required hospitalization, for example, after, let's say, hip replacement or kidney transplant, that sort of thing. And clearly those types of surgeries and procedures were decreased and have not been restarted again in our hospital system. And you have to remember that not all healthcare workers are interchangeable. That is, there are different skill sets that are required for the cases that we're seeing now versus the ones that we saw before COVID-19. So we understand that it is extremely challenging for the hospitals to maintain this important capability to respond to COVID while not doing a lot of the things that they did before COVID. And really the details should be referred back to the hospitals themselves to talk about their own staffing decisions. But another point that's very important, and that we actually are very concerned about here in the county, is that there may be somebody or some people out there in our community who are not going and seeking care in our emergency departments that really do need to. This has actually been touched on before in our prior news conferences. Dr. Ifatides actually made a very important comment on this a number of weeks ago, but it gives me an opportunity to say it again. The number of people who we're seeing in our emergency departments with things like stroke, with heart attack, with diabetes out of control is not as high as it was before COVID. And there have been some national studies that looked at the possibility that there may be people who are waiting too long to come in, and this in fact is leading to increased illness and perhaps even deaths. We're actually looking now at our recent death data to see if we have any trend like that locally. But I can tell you that talking with my emergency medicine colleagues in the community, they are seeing anecdotally people that wait a little too long before they go in. And so I really do want to send the message that somebody who has chest pain, someone who has a new onset neurologic deficit like weakness or numbness or facial droop or visual problems that are acute, that is a reason to seek care emergently. And it's important to know that going to our local emergency departments in San Diego is safe. They are using good infection control practices in our local emergency departments. And if you are going to seek care not for COVID, but for something else that you would have otherwise gone to seek care for, and certainly for the categories of illness I just described, you should access emergency care. You should call 911. You should get the care that you need because it is important, especially with those disease entities, that you be treated quickly because it could be life, limb, and vision and neurologic saving. So I did want to make that point.
Thank you.
Okay, let's go to the next question.
Danny Freeman with NBC7, please state your question.
Afternoon, everyone. I have two questions here. The first, as I understand it, technically the current county public health stay-at-home order is set to expire on April 30th. Will that be extended tomorrow? And if so, how long can we expect the stay-at-home order to be extended here in the county? And my second question is, just to be absolutely clear, is there any possibility of San Diego County reopening businesses or easing those restrictions on a timeline that is earlier than what the governor laid out this week?
Okay, Dr. Wooten's going to respond.
Two things. In terms of the extension of the current health officer's order, we will be extending that indefinitely because we, in terms of opening up, as you heard from the governor yesterday, any jurisdiction opening up is contingent upon the guidance and direction from the governor of California. So we cannot open back up until the state gives the red light, the green light to do so. So yes, we are extending tomorrow, April 30th, indefinitely.
Okay, next question.
Jesse Marks with Voice of San Diego, please state your question.
Hey, thanks for taking my question. So Supervisor Fletcher talked earlier about parks, and I wanted to follow up on that point because I think there's some confusion there. So the city of San Diego has said that sitting by oneself or with housemates is okay because they consider that to be a passive activity. But I heard Supervisor Fletcher on Monday say that, or highlight the fact that the countywide rules on parks allowed for walking, running, and biking, but sitting and stopping was not allowed. So can someone just clarify for me, what are the rules for sitting in parks, and do the county's rules override those of the cities in, with this respect?
Okay, I'm going to let Supervisor Fletcher respond.
Well, I think the effort that we've undertaken over the last week and a half or so, we hope to rectify a lot of that countywide tomorrow, where we can potentially issue an order to lift some of those restrictions so that there is consistency across jurisdictions as it relates to what type of activities you can do. And so our hope has been in working with cities. We've talked now for probably a week and a half about the types of plans we would like to see in place in each of our parks around staffing and physical distancing and enforcement and other types of things to allow for more opportunities to go forward. So I would just say check back tomorrow, and I think we'll be able to provide a consistent framework that can be put in place around the county in terms of all parks and all jurisdictions.
Okay, but if I went to a park right now, can I sit down?
Look, under the county's public health order, the aim was to have people begin to move through. If the city of San Diego has done something differently and they have the ability to ensure physical distancing, given we are right on the cusp of perhaps changing the entire approach, I don't think that there is a great conflict there because we are in the process of kind of resolving that, and I think tomorrow we'll be at a point where we can move forward and do it. I think the most important thing is for each of our local jurisdictions to be able to ensure physical distancing. Household units are the only ones that are in close proximity to one another. along with ensuring, whatever hygiene standards are available and applicable. And so I don't think that there is inherently a tremendous conflict. To the extent that there may be some miscommunication, I think that we'll be able to resolve that tomorrow.
Okay, I appreciate that. And one final thing then, are you giving any discretion to law enforcement on when to and not hand out tickets? Can we expect that in tomorrow's update?
Well, no, you don't need it in tomorrow's update, Jesse. We've said this probably 20 times over the time, that the enforcement mechanisms are always at the discretion of law enforcement. And so the discretion at the enforcement of the officers is with the local jurisdictions when they're in their local jurisdictions, and in the unincorporated and contract cities, it's with the sheriff. And so they have the authority to use their appropriate discretion in enforcement on public health orders, just as they have that same discretion for individuals who are speeding or any other type of entity that's going out there. What we would like to see is the most appropriate steps taken to ensure the broadest possible compliance with the orders countywide. Again, achieving the aim. The aim is to ensure physical distancing. The aim is to ensure it's only household units that are in close proximity with one another. Those are the things we do that will prevent outbreaks and spread and more community transmission of coronavirus. And I think that local jurisdictions, the county, law enforcement are all doing the very best they can to navigate through a challenging and difficult situation. And we appreciate local jurisdictions' continued flexibility and cooperation as we all try to achieve the same aim.
Okay, thanks.
Okay, we'll go to the next question.
Will Huntsberry with Voice of San Diego, please state your question.
Hi, everyone. Thanks for taking my call. So you guys have talked about the 5 criteria for reopening, and I've asked about that a couple times, and I saw you had a chart today on that, which was helpful. So there's 2 criteria that we're not yet meeting. I have a question about the 14-day downward trend in COVID symptoms. So you guys are saying now that we're in progress of meeting that meeting that criteria. What is the day you're counting from there? For how many days roughly have we been heading in the right direction on that?
Okay, Dr. Wooten's going to respond.
So, Will, I want to correct you a bit. What I showed was a slide that we showed the very first time. If you can go back, if staff can go back to that slide. And I use that to transition to show you the graphic where we are on a downward slope for both influenza-like illnesses and the COVID-19 syndromic cases. So we are trending in the right direction for both of those 2 metrics.
Right. But you said that we had met the influenza one, and then you said we were in progress on meeting COVID, I think.
I said 2 weeks, when I first showed this, I said we were in progress. But today, I showed data that shows that both of those are, right here, are on a downward trend. So if you go back, if you will go back, staff.
Got it. So we've actually met.
Yes, sir. Yes, sir. We have met metrics 1 and 2. We've met metrics 3, which is what's showing here, and not the, but if you can just go for it. We've met, so these are the 5 metrics. Under symptoms, there are 2 metrics: downward trend for ILI and downward trend for COVID-like syndromic cases within the last 14 days. And we, for both of those, we are meeting those. Third is at the bottom under cases, downward trend of positive tests within a 14-day period. We feel we are achieving that. Then treating all patients without crisis care model. We show you our hospitalization numbers. We are meeting that. And as Supervisor Fletcher stated from the governor's briefing yesterday. We will be adding in ICU cases there because they are a subset of hospitalizations. And then the last is robust testing, which I shared with you our process. And I actually neglected to share that yesterday was the 20th, on the 27th, we actually tested 2,500 individuals. And later today, we'll know the numbers for yesterday, but our goal is to increase testing by 500 per day. So we are well on our way, we hope, with the robust testing. And as has been shared with you, we've opened up drive-through sites in North County, in South County. We have other sites for Euclid Medical Center will be opening. We'll have a drive-through on Saturday and Sunday this weekend, and we are identifying other sites. We are working with our hospitals to have them pair up with the SNFs in their catchment areas to make sure that those entities are tested, and we are doing the same thing for our outbreak congregate care facilities. So we are confident that we will increase and meet our testing goals over the next week. So does that answer? Yes, go on.
Yes, no, thank you for that. Thank you for the clarification on the one part. I think I understand that part now. So say we do increase testing by 500 a day, as you guys are hoping, or once we're able to get to a robust testing place, at that point we will have met the 5 criteria, but will we still be waiting on the governor at that point?
Yes, sir. We still have to wait on the governor. So in the interim, we are planning, we are preparing, getting our metrics in place, working with our partners to make sure that when we are ready to open, that we can open things back up at a metered approach, but in collaboration with all of our business partners. And as you know, schools, whatever comes out of the governor's recommendation, we are still working with our schools and our employers and various businesses throughout the county so that everyone is satisfied with the process with opening up. But it will be a metered approach, as the governor laid out yesterday. We are currently in stage 1, but there are several other stages that we have to work our way through. So everything does hinge on the governor's guidance and directive. Thank you.
Thanks.
Okay, we'll go to the last call-in question.
Hello, caller. Will you please state your name, outlet, and your question? This is a caller with the last 4 digits of 9343.
That was in error.
Okay. All right.
Okay, we'll go to the text questions.
My first one is from ABC News. When is the county planning to allow golf courses to reopen?
Well, actually, tomorrow at our briefing, we will have a complete update on that. There is a form that is on the coronavirus.sd.com page for all of the golf courses in San Diego County. I think there's 73. They can review that, and they can fill that out. If they can comply with the guidance that is there, the directions that are there, then I think tomorrow we'll be announcing that they'll be able to open shortly thereafter. We will have a complete update on our healthcare directive tomorrow, and the effective date of those changes will be on May 1st, on Friday. And I think that answers the question.
All right, thank you, Chairman Cox. And I have a question from Eric Kahnert at News 8. Our morning viewers would like to know what the total number of recoveries are in the county. So what is the total number, and is that number available daily?
Okay, I think Supervisor Fletcher went over that, but we'll go ahead and ask him to follow up on it.
Thank you. The number, it is available daily. We do brief it daily. I just did a few minutes ago, but I'll go through it again with you. It's 1,892 is our estimated recovery, and we will continue to brief that daily along with update that daily on our slides that are out there. And again, this is based on, it is an estimated recovery of 14 days after positive cases, adjusted for any loss of life.
Okay, we have a question dealing with testing sites in southeast San Diego. Dr. Wooten will respond to that, but go ahead and ask the question.
Yes, this is from Andrea Lopez Villafana from the Union Tribune. Does the county have plans to open a testing site in southeast San Diego, the city of San Diego?
Okay, Dr. Wooten?
Thank you for that question and the opportunity to share this information with you once again. We indeed are opening up this weekend at Euclid Medical Center, a testing site on Sunday and Saturday and Sunday. So the answer, in short, is yes, this weekend at Euclid Medical Center.
Okay, I have another question for you from Saddam from Univision. Almost half of the deaths reported by COVID-19 have been within the Hispanic community. Is there any factor contributing to this population having the second most cases and deaths?
So if we can share the demographics for deaths again, and that information is incorrect. As I shared the information with you, and our demographics for Latinos is about 36%, 52%, 33, I can't see that far because 33% of our total number of deaths, is this deaths? Have been in Latinos, not over 51%. So whites at about 52% and 33% Latinos. And is that 6 or 8%? Asians, the next number.
He also says different studies have suggested that the lowest income communities are the most impacted by COVID-19. Is this something that the county has identified in San Diego, and what measures are being taken to prevent more cases in the most vulnerable communities?
Well, as I actually stated in my remarks, we feel that our numbers are not higher in our older populations because they are adhering to the guidance and are staying at home. We would have to do additional research to look at the demographics of whether people had, we know people had underlying medical conditions, but we would have to do a deeper dig to look at those types of demographics. But we don't have those right now, so we will look at those demographics in the coming months or 2 weeks.
Alexandra Meeks from CNN, are there any indications that an influx of dual citizens from Mexico are seeking COVID-19 treatments at hospitals in or around Chula Vista?
So we actually, I met with Chairman Cox at about 1 o'clock today with the mayors in South Bay, and we shared what the available data is. And the available data is that if we look at emergency transfers at the border, and we looked at the last 3 years for Chula Vista, Sharp Chula Vista, and Scripps Chula Vista, the numbers are not greater. They are either second or the lowest for the two hospitals. So the impact, even though we know that there's a lot of strife going on the Tijuana side of the border, and there are a few individuals that are being seen in our South Bay hospitals, but these are U.S. citizens who have the right to come over and seek treatment if they want to. While TJ or Baja California has a significant impact, it has not, we've seen some of their cases, but it has not impacted our total capacity. But we're still continuing to monitor that because that could change, and we, again, are continuing to monitor the activities through our local hospital capacity and beds, through our EMS system and through our Customs and Border Protection system. Yes.
And if I could just do a quick addition to that, we're in close contact with the hospitals in the South Bay, and certainly anecdotally, we're hearing from them on a daily basis that of the new individuals that come in with symptoms of COVID, who in fact are being confirmed with COVID, about half those individuals are endorsing travel to Mexico within the last 14 days. So there is certainly an effect of people presenting to hospitals in the southern part of the county who have direct connections and travel to northern Baja California. How many of them are specifically dual citizens versus individuals who are U.S. citizens who happen to be living in Mexico is difficult to ascertain, but really the gist of your question is that there are an increasing number of individuals with recent travel to or residing in northern Baja California who are in fact presenting to our southern hospitals in the county. Again, we're tracking that very carefully. It is an increasing trend and is certainly part of the increasing number of cases that are being seen in northern Baja California.
Thank you. Dr. McDonald.
Before we get to the next question, I just wanted to clarify one point that was made earlier. The Euclid site for testing is actually going to be on Saturday only, not Saturday and Sunday, so it'll just clarify that point. The next question, I believe, deals with the homeless situation at the San Diego Convention Center, and as that question is being asked, I'll ask Supervisor Fletcher to come up.
Yes, this is from Gary Worth from the Union Tribune. Are any homeless people at the convention center from areas outside of San Diego city limits? And if yes, who is doing the outreach to connect them with the shelter?
Yeah, Gary, I'd have to refer you to the individuals that are running the intake process at the convention center. The county is obviously there in a supporting role, providing public health support, mental health services, and a variety of other functions. But the intake procedure is being run in a coordinated effort between the RTFH and the City of San Diego, so I'd have to refer you to them on that question.
I have a question from Mimi from Channel 10. Can I have more specifics about the face covering requirement that begins May 1st? When can people go without them? Do people working out need to have them on? Do young children need to wear them? Thank you.
Hi, Mimi. We've outlined, and we will continue to outline, including tomorrow when we make the order official, additional guidance. The order is essentially when the aim is when you leave your house that you have a face covering on. The actual letter of the order says that you should have it with you, but when you come within 6 feet of a non-household member, you should cover your face. And so we're going to ask San Diegans, we're going to have to apply a little bit of common sense in that if you're not within 6 feet of somebody and there's no chance you'll come within 6 feet of somebody, then you wouldn't have to have it up and covering. There are also exemptions. Children 2 and under are not covered by it. Along with tomorrow, we'll outline some other exemptions around child care facilities and individuals who have a medical condition documented by a doctor that precludes them from wearing it, again, would be exempted from it. And so the aim is to ensure that we're all doing everything that we can to not only protect ourselves, but more importantly, to protect us from spreading it to others. And yesterday, our medical doctors walked through some of the science and research behind why it's important. But we do think it is an important part of our ability to begin easing and opening is working and living and existing in kind of a new posture for a while. And so we'll continue to explain and share more guidance and information. But at its core point, when you leave your house, you should have a face covering. And any time that there's a chance you're going to come within 6 feet of a non-household member, you should make sure that you're utilizing that face covering.
This next question deals with COVID-19 testing, and Dr. Wooten's going to respond.
This question is from Lindsay Winkley with the Union Tribune. I just want to make sure I understand the COVID-19 testing slide. Does that mean any of those risk groups, anyone with pre-existing conditions, anyone who lives in a rural area, even those without symptoms, can call their doctor to schedule a test?
Yes. So if you can please show the slide again that shows the an overview of the groups. Pretty much. But in short answer, yes. Individuals in rural areas, individuals There it is right here. So vulnerable populations, individuals with HIV in rural areas, Native Americans and other racial and ethnic groups, older adults, people experiencing homelessness, and then healthcare workers, or rather first responders, individuals that are exposed to individuals with COVID-19, and people with underlying medical conditions. And I think we've provided those to you already: heart disease, diabetes, chronic lung disease, asthma, COPD, compromised immune systems. And we are testing individuals in congregate living facilities, both staff and residents, and then other essential infrastructure occupations. So this is a broad brush, and we are trying to make it so that all of these various populations, particularly the vulnerable populations, can be tested.
I have another one from Derek Stahl from ABC 10. Supervisor Fletcher and Dr. Wooten have repeatedly said they cannot move forward and reopen businesses until ordered to do so by the governor. However, 6 counties in the Bay Area announced today they will reopen certain outdoor businesses and other facilities on Monday. Can you please explain why there is a disparity? Is San Diego County simply deferring to the spirit of the state's order, or does it feel it is actually bound by the letter of the law differently than Northern California counties?
Well, I haven't seen what Northern California is doing, so I'd have to review that before I can comment on the question. But again, we are waiting on guidance from the governor, and I don't think that is any different throughout the state. So once we, thank you, once we review that, we can be able to better respond and provide an answer to you.
Okay, thank you.
Okay, what's the next question?
Yes. This is from Andrea again. Are there 2 Euclid clinics? Is it the one in Oak Park? The Euclid Medical Clinic is in Mid-City, not really southeast, unless I'm wrong. Just trying to find clarification on where exactly the southeast clinic is.
Okay, Dr. Wooten's going to respond.
So the drive-through on Saturday from 8 to 2:30 p.m. is at Euclid Medical Center at 4440 Euclid Avenue. So it's just before Euclid and Imperial. Thank you.
Okay, that, I believe, concludes our questions for today. Before we close, I want to take an opportunity to update something that we talked about yesterday. As we discussed yesterday, our medical people are in regular contact with Baja California officials about the COVID-19 situation, and we have also reached out to the state and federal government for assistance on this issue. It bears repeating that diseases do not respect boundaries, and for us to respond effectively to COVID-19, we need for Tijuana to also be successful. As cases are expected to rise, increasing access to personal protective equipment and medical supplies such as ventilators is critical to stabilizing the situation in Tijuana and our border community. The County of San Diego has put together a binational sector to focus on cross-border communication, sharing informational resources, and facilitating support. There are also organizations that are working with various partners to raise money to purchase critical supplies for Tijuana. If you are interested and able to support our neighboring community of Tijuana, the International Community Foundation has established a fund to raise money for much-needed personal protective equipment and medical supplies. To help, you can visit icfdn.org. Again, that's icfdn.org. We want to thank the International Community Foundation and to all who are helping our people on the front lines. So with that, it kind of covers it for today. We'll see you tomorrow at 2:30. And again, stay in place, maintain space, and cover your face. Thank you.